Hello, everybody. My name is Cameron, and I'm the Aflac representative for Beachfront Properties. Thank you for tuning in. I appreciate this. That it's really important that people get a clear understanding of how Aflac works. The problem is that you see the duck commercials, but they don't explain how Aflac really works and how it helps you and how it helps your family. So if you just take a moment and pay attention to this video at the end, you'll have a very deep understanding of how the plans work. And you can make a clear selection as to what you want to do. So the first thing I want to show you is that I can't go into details of all of the how the plans work, but you're going to get some brochures that tell you all the specific details. So I don't have time to go through everything. So let me describe real quick why Aflac is important and how it fits into your other insurance. And it really revolves around two problems. So if something was to happen to you or something was to happen to your family, the first problem is you're going to have out-of-pocket medical expenses, the deductibles, the co-pays, the max out-of-pocket expenses. The second problem is the most serious, and that's if we can't work, then you don't get paid. So in that scenario, if you can't work, our health, and something happens to us medically, our health insurance kicks in and starts paying doctors and hospitals, right? And that's important. But our health insurance doesn't pay us. So Kaiser, Blue Cross, they've never sent me any checks for my car payments or my mortgage. So that's what Aflac does. Quite simply, it pays you cash directly after an accident or after an illness. And that cash is for you. It's you can decide what you want to do with it. It's like, think of it as a safety net that comes into your hands right after a very difficult situation. So Aflac pays you, not the medical facility. So there's some very important things to understand about these plans and how they work. And this applies to all of the 4 plans that are available to you. Number one, the rates never increase. So you know how if you get in a car wreck, your auto rate goes up, your auto insurance goes up. Not true with Aflac. Your rate for your Aflac plan will stay the same forever. And that leads me to the next point. You can take your Aflac policy with you. So even if you leave your employer, you can take it with you. So instead of doing a payroll deduction, you will do a direct bill. So that you'll no longer have a payroll to have it deducted from, and you can just set up a direct bill with Aflac. And when you do that, the rates don't change, the benefits don't change. That's one of the great assets, the great benefits of Aflac. You have 24/7 coverage, so it doesn't matter where you are. You can be on the job, off the job, or even traveling in another country. Something happens, Aflac pays. We have next day pay. So if you use our online system, which we'll tell you about how to use. It's real simple. You will be paid the next day. You can also get paid through direct deposit. Set up a direct deposit link. When you enroll in a plan, I'm going to send you a claim instruction sheet, and this tells you exactly and specifically how to file a claim, especially how to set up your online portal. And Aflac pays no matter what other type of insurance you have. So it doesn't matter if you have disability or whatever else you have, Aflac pays you what it says. So what other insurance you have is not affected. All right, so you have 4 plans available to you. You can enroll in 1 plan, 2 plans, 3 plans, or 4 plans. Think of it as a menu at a restaurant. You can pick as many dishes as you want. You can enroll in a combination of plans or just 1 plan or no plan at all. That's completely up to you. So as you can see, all these plans function differently and they cover different scenarios. So let me go through the 4 plans real quick so you can get an understanding of how they work. And once you understand the first plan, I think you'll understand the rest. And the first plan is the accident plan. So it's the most popular. It's very inexpensive. It pays after an accident. So if something happens to you and you need medical attention, it's because you're either hurt or sick. So this only covers the hurt side. So car wrecks, you fall down, cut yourself, sporting injuries, those kinds of things. Any type of accident, this plan pays. And how it pays is 100% based on what happened. So it has a list of medical events, and each medical event triggers a check to you. It's that simple. So I'll just rush through the medical events and you can get an idea. So for example, let's start with your first initial visit to the ER, urgent care clinic, or even a dentist because you bust a tooth. It's going to pay you between $125 to $205, and that depends if there's an x-ray or not. Also, it's going to pay a sum between $35 all the way to $12,500, and that sum is based on how bad your accident is or the type of accident. So the worse off the accident, the bigger the check. Now, you got to go back for follow-up visits or physical therapy, like you got to go back to get the stitches taken out, $35 per visit. Now, if hospitalization is involved as a result of an accident, so the way it works is it pays a lump sum for the first day of hospitalization of $1,250. Now, remember, that is a check to you, not to the hospital. You can use whatever you want. So it doesn't matter where the hospital is. It could be in another country. That first day of hospitalization, it pays $1,250. And then it pays $250 for every day thereafter. So from day 2 and beyond, there's no limit to how many days it pays you, $250 per day. Now, if it's an ICU, intensive care ward, it's $2,500 for the first day and $400 for every day thereafter. Diagnostic exams, ambulance, air transportation like a medevac, family support, someone's got to come to your house to help you out. Home modification means like a ramp or a brace in the shower, something like that. Rehabilitation units, $150 a day. Appliances are like wheelchairs, crutches, braces, and then there's prosthetics, repair, replace prosthetic, blood, transportation, lodging. If you got to go to another city, you'll need transportation and lodging. I'm talking about for treatment, then this kicks in. Now, accidental death life insurance. So if you die in an accident, your beneficiaries will receive $40,000. So that's included in the plan. So that will pay on top of any other type of life insurance that you might have. Dismemberments up to $40,000, and that depends on the body part that's dismembered. If you are organized or your family is organized in an organized sport like a soccer league or whatever, all these numbers you see in this are going to increase by 25%. Wellness benefits. So everybody loves a wellness benefit. It has nothing to do with an accident. They include it in the plan. Think of it as a reward for doing something for the benefit of your body. So you got a teeth cleaning or eye exam, physical exam, very broad range of wellness benefits. This plan is going to pay you $60 a year. So every year that $60 renews. All right. So let's go to the next plan. It's the hospital plan. So the benefit of the hospital plan is it covers all scenarios. That's accidents, illnesses, and maternity. You go to a hospital to have a baby. So, and this would also cover, if you're listening to this during a COVID-19 situation, this would cover a COVID-19 hospital stay and medical treatment. So the way it works is simple. If you're hospitalized for whatever reason for 24 hours, this will pay you $1,000 per hospitalization. Remember, that's paid to you, not to the hospital. It's that simple. Now, it also is going to pay you an additional $100 per admittance and a daily benefit of $100. So actually, it's going to pay you $1,200 for the first day, and then it pays you $100 per day thereafter. If it's an intensive care ward, it's $500 a day. Rehabilitation unit, $100 a day. Hospital short stay means you're there for less than 24 hours, $100. And then it has other benefits in the hospital plan that have nothing to do with necessarily being hospitalized. You don't have to be hospitalized to get these benefits. You can be, but you don't have to be. So for example, the doctor visit. Think of it as a wellness visit. You go for a physical exam, any type of doctor visit, even telemedicine, it's going to pay you $25 per visit. ER visits, $100, lab tests, x-rays, basic diet, you could read the rest of that. Surgeries, up to $1,000. It depends on the severity of the surgery. So it has other benefits as well outside of just being hospitalized. All right, let's talk about the third plan, and it's the cancer plan. I hope everybody considers this plan. If you've had family members or someone in your circle of friends have dealt with this, it's really difficult. It's a bankrupting disease. It sucks money out of you. It causes a lot of financial pressure, and that's what this plan is for. It puts money, a lot of money, in your hands during a difficult time. It covers one disease and one disease only, and that's cancer. So the way it works is that it starts with initial diagnosis. So a doctor gives a formal diagnosis of internal cancer. It's going to pay a lump sum of $4,000 or $8,000 if it's one of your dependents. So that number of $4,000 and $8,000 is only for the first year. So every year this grows. Every single year, the number grows by $500. So 2 years from now, that lump sum will be $5,000. 3 years, 4 years, et cetera, et cetera. So I've met people that have had this plan for 12 years and then they get a diagnosis. So you can imagine that's just the first line of the plan. It also has a cancer screening benefit of $75 per person once a year. So you go in and get your checked, a blood test, or all the different ways that we get tested. If you do have a diagnosis, then that $75 wellness is going to kick in 3 times a year, not just 1 time a year. And then annual care. If there is a diagnosis, this plan will simply pay you $200 every year for 5 years. Now then, it has other other benefits based on medical treatment. I'm not going to go through them all. I can't pronounce some of them, but of course, the most common is radiation or chemotherapy. It's going to pay you $250 per treatment, or $1,200 if you go to a doctor's office to get it done per treatment. So, and then hormonal therapy, topical chemotherapy, anti-nausea, stem cell, bone marrow transplant, which is becoming more and more common, $7,000. Donation of stem cells or bone marrow, surgery up to $3,400. They're going to pay up to 25% of your surgical bill, of your surgery bill and anesthesia bill. Hospitalization, $200 a day, $400 if it's more than 40 days. Outpatient surgeries, home health care, extended care facilities. Hospice, $1,000 for the first day and then $50 every day thereafter. And then you could read the breast reconstruction, other body part reconstructions, ambulance, lodging. All right. So let's go to the next plan. So the next plan is, I sometimes call it a sister to the cancer plan. It's just about the same thing, but it covers other critical illnesses. But it has inside the plan an intensive care ward benefit. So if you or your family is inside a intensive care ward for no matter what, and again, including COVID-19, it doesn't have to be because of any specific illness. It could be anything, even an accident. It's going to pay $800 per day for the first 7 days, and then $1,300 for day 8 to 15. And then $500 a day if it's in that step down ICU. And those numbers are increasing by $2 a month. No lifetime maximum. So it doesn't matter how many times you go in there, it's going to pay in that manner. All right, so back to the critical illnesses part of this plan. It has that lump sum, just like the cancer plan, a $7,500 lump sum. And then $10,000 if it's a dependent. Again, same thing, only in the first year of coverage. That number is increasing by $500 every year. So 2 years from now, $8,500, 4 years from now, $9,000, et cetera, et cetera. So these are the list of the critical illnesses it covers, heart attack, stroke, and you could read there for yourself. These are the big ones. These are the ones that really knock a person out financially. Now, treatment benefits. So let's say after the lump sum occurs and you're going through your treatment to recuperate, it's going to pay you $125 a day. So let's say you have a stroke and you need speech therapy. Every appointment that you have for speech therapy is going to pay you $125. If you're hospitalized, it's going to pay you $300 a day. And no maximum, no lifetime maximum. Other benefits, coronary angioplasty benefit, $1,000, ambulance, transportation, and lodging benefits. All right. So thank you very much for listening to this. You should have a summary of plans Word document, a sheet. It's going to list all of the rates. You will notice that some of them are age banded, meaning that the older you are, the more it costs. I want to emphasize that the way the rates work is that once you are in that age bracket, that is your rate forever. So if you remember, if I told you that rates don't go up, so even as you get older, it's not, your rate doesn't get into that higher age bracket. You have the option of including just yourself, which would be the individual option, one parent family. means that you and all your kids have it. The plan have the coverage up to the age of 26. They don't have to live with you. Employee spouse means you and your spouse have it, but no dependents, no kids have it. And then the whole family means everybody has it. So for example, if you do family coverage and then you get in a car wreck with everybody in the family, then all those numbers that you saw would be times however many people are in the car. So it's that simple. So I want to invite you to reach out to me by phone or by email. I can give you personal recommendations. If there's something here I didn't cover, please do not hesitate to call. When you use your online system to select your benefits, if you're having a problem with the Aflac portion where you elect it, please let me know. All right, so there's my number, there's my contact information. Thank you very much for listening to this. I look forward to getting to know all of you in person.